everyone. So I'm going to share my screen. Okay, there we go. All right. Yeah, good afternoon, everybody. I hope you can all hear me well because I've been having some microphone issues. So please say something if it doesn't work. Yeah, thank you, Heather, so much for the opportunity to present my research here in this session. This is a really great honor. My name is Lilian, and I'm a PhD candidate at Maastricht University, where I'm being supervised by Henry Otgaar, who I'm sure a lot of people know. And my research combines the two fields of forensic psychology as well as psychopharmacology, as I'm interested in how popular legal but also illegal drugs affect false memory. So I do both studies in the lab, where we even administer drugs to healthy people and test their memory, but also in the field, for example, at music festivals. So today my focus is going to be on a lab study that was recently completed on the effects of MDMA on false memory in an applied legal context. So, but first, what is MDMA? Let me give you a little bit of background. So MDMA is one of the most widespread drugs all across the world. And to make a little bit better sense of the title, it is also known under its street name Molly, or also known as the hug drug. And my favorite fun fact of all time is that even octopus would start hugging each other when they are given MDMA, even though they're normally very solitary. So MDMA is the main ingredient of the popular party drug Ecstasy, but whereas Ecstasy usually comes in the form of pills and is combined with other substances such as speed, pure MDMA comes in form of powder or crystals, as you can see here. And the effects of pure MDMA are actually quite well studied so that it can be safely administered to human participants under controlled conditions. MDMA combines stimulant and empathogenic effects, meaning that it has very unique effects on emotions. So yeah, such as increased mood, euphoria, empathy, and feelings of emotional openness. And recently, MDMA has attracted a lot of empirical attention for its very promising therapeutic potential in the treatment of post-traumatic stress disorder. So where it is administered in conjunction with psychotherapy. And it's been so successful that it has even received the label of breakthrough therapy. So in terms of effects on cognition, MDMA is a little bit odd because it acts as a psychostimulant. It has been found to induce improvement on some variables, such as on some driving tasks, whereas other dimensions, such as some types of attention, have been found unaffected. But in other domains, MDMA has been found to produce impairment. And a particular one is true memory, or memory for events that were truly experienced. So evidence that MDMA impairs true memory comes from two lines of investigation. So on the one hand, we have acute studies in which MDMA is administered to people. And there we see impaired verbal memory after taking MDMA when somebody is intoxicated, but not 24 hours later. And the other line of investigation is from retrospective studies where people who have used MDMA for a long time are compared with either non-drug users or polydrug users. And there we see subtle but consistent working and verbal memory deficits. But I should mention that the effect sizes in these studies usually tend to be small, and the impairments people still score within the normal range of memory performance. So, however, what has not been assessed directly yet is whether MDMA has any effects on false memory or suggestibility. And we know from, for example, alcohol research, but also recent research that I did with cannabis, that substances can sometimes elevate our risk to form memory errors, to form false memories, or to be more suggestible. But MDMA is a substance that has not been studied in this context before. And there are several reasons why it's relevant to study this, because yeah, basically MDMA is a nightlife drug. A lot of people take it when they go out, and we know that a lot of crime happens in nightlife. So this increases the chance that, yeah, sometimes people will be intoxicated, witnesses to a crime or even suspects of a crime. And also we know from police research that intoxicated witnesses are common. So police officers often interact with intoxicated witnesses on the job or even question them. And finally, it is relevant to study this in light of the recent clinical developments I mentioned, because particularly because reprocessing memories is a crucial part of trauma therapy. So to shed more light on this issue, we conducted a study to answer the research question, does MDMA increase the susceptibility to spontaneous or DRM false memories, as well as suggestion-based or misinformation false memories? And to test this, we conducted a randomized, double-blind, placebo-controlled trial, which is known as the gold standard in psychopharmacological research to really isolate the effects of a substance. So we used a mixed design, meaning that every participant once received the drug and once the placebo, but spontaneous false memories were tested within subjects, whereas suggestion-based false memories were tested between groups. And the participants were 60 healthy individuals with some previous experience with MDMA. And the treatment consisted of a dose of 75 milligrams of MDMA mixed with some bitter lemon drink to mask the bitter tastes. And the placebo was just bitter lemon drink. And then we had 2 testing occasions. So testing took place immediately, so during acute intoxication, so that encoding and retrieval took place under intoxicated conditions. And then another week later, people came back. And so we had this delay and a 1-week sober follow-up session. And then really briefly about the methods, I'm sure everybody is very familiar with the DRM paradigm, but maybe of note is that we used 15 associative DRM word lists at encoding, just like the one you see here on the left. And then the recognition test took place in the immediate condition 10 minutes later, and in the delayed condition 1 week later. And in the recognition test, we used a combination of truly encoded words, and different new lures, so words that people did not encode. And all these recognition test items varied in the level of associative strength to the encoded lists. And as for the misinformation paradigm, we used 2 distinct mock crime scenarios, and they were presented in virtual reality. So it was a fully immersive experience. And we had a perpetrator and an eyewitness scenario. In the perpetrator scenario, I should mention, each participant received each scenario, but during counterbalanced treatment conditions. So the perpetrator scenario took place in a bar, where the participant walked around and was instructed to steal a purse, and misinformation was introduced through suggestive questions in a later interview. And then in the eyewitness scenario, the participant was seated on a train, witnessing a fight outside at the station through the window. And misinformation here came from a virtual suggestive co-witness, but also from suggestive interview questions. And then the interview for both these scenarios, as well as both the immediate and the delayed condition, was a combination of true and false memory questions. So they were questions about 3 types of details: presented or true details, suggested and false details, and non-suggested false details. And the format was voice choice recognition. So now I'm going to get to the results, and I'm going to start explaining the DRM results. So we see here the results from the immediate condition, where people were intoxicated, and the black dots are the MDMA condition, whereas the white dots are the placebo condition. And on the left, we have the hits, so response rates to the old words, followed by the 3 categories of lures. And here you see that it's decreasing in level of association. So as you see in the results, you see that MDMA reduced true memory ability in this immediate condition, but it increased the false alarms or false memories of related lures. And then I've added the delayed condition. And yeah, 1 week later, we see still that true memory was impaired for people who had been intoxicated during encoding. But this time we see even reduced false alarms of critical lures for the MDMA condition. So finding that true memory is reduced through MDMA is in line with literature that MDMA impairs verbal memory. And also finding that false memory in the DRM is differentially affected depending on which memory stage in particular is most strongly affected by a certain drug is not actually uncommon. So it could be that MDMA at retrieval might increase the risk for associative false memories, whereas it might reduce it when MDMA is only present at encoding. So this could reflect a general encoding impairment, and this could also explain the impairments in true memory. And these results are also in line with some findings by Doss and colleagues who found increased false alarms for emotional pictures when MDMA affected retrieval. But we would need a design where to fully disentangle the effects on encoding and retrieval, where these memory stages are fully separated. And then also the effect sizes were rather small here. So keep in mind that this was a within subject comparison. So we had higher power to actually detect effects. Okay, and now we get to the results from the eyewitness scenario. This is again the immediate condition. And we see that the hits were quite high in this, in this scenario. And the false alarms here and here for the different categories were quite low. And you don't see any statistically significant group difference. So MDMA didn't seem to have an effect here. And then a week later, we have a little bit of a surprising finding where actually the placebo group scored higher and had elevated false memories in response to suggestive questions. And this was also in line with the signal detection measure that we calculated, where the MDMA group showed a more conservative responding pattern. And then here I'm presenting the perpetrator results all at once because we did not find any statistically significant group differences here. So it seems that, what we found in the eyewitness condition didn't really replicate, and the effects are really not consistent in this applied episodic memory task. So this led us to conclude that perhaps, in this task that we used, drug effects of the drug were weak to perhaps non-existing. And then just a short recap before we get to a general discussion. It seems that the DRM was more sensitive to drug effects. So we detected small memory impairments in response to MDMA at both time points, particularly pertaining to true memory ability. False memory was differentially affected, which mirrors other drug research as well. However, MDMA did not consistently affect memory performance in the two misinformation tasks, and we did not find any evidence that MDMA increased the tendency to go along with suggestive questions or to be receptive to misinformation, which is, I think, quite striking, and perhaps it is good news. But of course, this was the very first study that actually assessed false memory in 3 different tasks in response to MDMA. So we need more research to replicate this and to shed more light on this. But overall, the findings are in line with the literature in the sense that encoding and retrieval are affected, but memory impairments tend to be small and subtle, especially when you compare it to other drugs like cannabis, where you really see a much bigger memory effect. And yet MDMA seems to display a really complex and unique memory profile that is also in line with this really unique pharmacological effect. So thank you very much, and a very big thanks also to my wonderful supervisory team. And I've prepared some questions for discussion, but I'm happy to hear, of course, any questions that you might have.
Brilliant. Thank you so much. Well done, Lilian. That was a great talk. I really enjoy how you investigate these drugs using so many different paradigms. I think that that's just so rich. I'm sure we all have a lot of things we'd like to ask you about. A couple of questions have popped up about the drug that you're using and about the dosage. How does the drug that you're using compare to street drugs? And how does it compare in terms of the dose that you typically see on the street?
That's a great question. I think I can't probably compare it completely to ecstasy because, as I said, it's often combined with all types of other substances. But I know that people also take pure MDMA when they go out. Like you can get it on the street. In terms of the dosage question, I've asked participants what the usual dose is, and most of them take much higher doses than what we have administered in the lab. I should say that other studies have used the same dose and have found memory effects, but I also suspect that probably this dose, higher doses could have maybe affected memory more strongly. So it would be great to, if possible, ethically, to do more research with higher doses. You're on mute.
Julie has asked if your participants had to answer all questions, or are they allowed to opt out and say they didn't know?
No, it was all forced choice. So they were instructed if they really didn't know that they should guess.
Another comment is, I would imagine that those who use MDMA on a night out would also be using alcohol. So do you have any future research aspirations into looking at combined effects of drugs?
I would love that. I mean, I think we first have to really understand the effects of each substance by itself. But I have done a study at a big music festival where people did combine substances. And it's quite messy, of course, because people, you just use all kinds of substances. But I'm currently, trying to analyze this study.
Great. I'll ask you, I guess, the elephant in the room question. Why do you think you see different results across the DMR and the Eyewitness task?
I think that's a very layered question. It has a lot of factors. I think the Eyewitness task, or both the Misinformation tasks, they are such a rich task in that you you experience this fully immersive scenario, and also because MDMA is a psychostimulant and people experience the scenario 60 minutes after ingestion. This is exactly when the stimulant effects start to take an effect. So your heart rate increases, your blood pressure increases, and my hypothesis is that maybe this even like sharpened attention a little bit, and it's much more exciting than a boring wordless task where you stare at words for 10 minutes. So I think it's really just like the nature of the task has a huge effect.
Yes, that's true. I had occasion to visit your virtual reality studio, and it was very exciting. And I was not on drugs, I hasten to add. Yes, so with the DRM, I mean, it just reminds me of a lot of eyewitness alcohol research that likewise finds that event memory is not impaired the way that the so-called basic memory research finds. So do you see any parallels there with the alcohol literature in the work that you're doing on other drugs?
Sorry, I was just in a thought. I wanted to mention again that, of course, the difference in findings might be because of a power issue, because we had within subjects comparison for the DRM. So I think that contributed a lot to finding these effects. And then also recognition is just, not so consistently affected. So I would be really interested to see if recall was affected in another study. But sorry, could you repeat your question, Heather?
Oh, I was just saying, do you see any parallels with the eyewitness literature? When you look at basic memory findings and you compare it to an eyewitness task, you see some similar things happen where the event memory studies don't show the impairment that you'd expect to find.
Yeah, I was actually thinking about that with alcohol, it's we often don't see any effects, but then of course it could often be a matter of dose and also a matter of delay between questioning and encoding.